Record levels of COVID-19 cases are being reported across the country, bringing into question what is and isn't working. On the forefront, testing. And as Britt Conway explains, experts are now considering a new approach.
Pool testing. Many health experts say it's the necessary next step in testing and tracing COVID-19.
Instead of taking an individual a nasal sample from somebody, you take a whole bunch of them and you put them together and you run a test on that whole batch. And then if it's negative, all those people are clear. But if it's positive, then you go back and individually test those samples to see who was positive.
The U.S. Food and Drug Administration issued recommendations for this testing strategy earlier this month, as companies and schools look to have mass screenings. Dr. Anthony Fauci says the White House Coronavirus Task Force is seriously considering this. Fauci told the Washington Post, something's not working. I mean, you can do all the diagramming you want, but something is not working. What you need to do is find the penetration of infected people in your society. And the only way you know that is by casting a broad net. Fellow task force member Dr. Deborah Birx agrees, saying pool testing is what is needed to get the testing numbers where they need to be. And she hopes this will eventually help people get back to their lives faster. For today's Health Minute, I'm Britt Conway.
The FDA has granted an emergency use authorization for Kroger's at-home COVID-19 test collection kit. The kits will be available to the company's frontline workers right here in Michigan based on medical needs starting this week. A healthcare professional will guide people through the process via video chat, and the samples will be mailed to a laboratory for testing. Most results will be available in less than 72 hours. Kroger hopes to process up to 60,000 tests per week by the end of this month.